I think California in general has had a lot of problems in terms of healthcare supply demand for a long time. And then post-COVID, we saw a major issue with lack of infrastructure for behavioral health in California as this population exploded.
I think that California's done a really good job in beginning to identify the gaps that we've had in services and say, we have a big problem and we need to put some big money toward developing the resource, developing the workforce, and developing the systems in order to be able to address that adequately.
Because this system has been built on the kindness of providers and their passion, which is fantastic. But this is the first time we've invested like this into the system.
So B-CHIP was created out of a needs assessment that was done looking at all these facilities throughout the state, getting data back, who are we missing, what populations are we missing, and how can we better serve them, and how can we open up more capacity. B-CHIP is all about expanding capacity.
To really reach those who are having challenges in accessing services.
And we have seen disastrous consequences when people that have mental health issues, when those issues are not addressed.
We need more units. We need more housing. This is the missing piece.
If you don't have the capacity infrastructure, specifically things like beds, outpatient clinics, you just can't treat individuals, right?
And this program allows from independent living all the way through acute care settings to invest and to build and to have a place for these people to go. Because we are building a new health system for those suffering from mental health, and it's never been done before.
And to make sure that it's done with quality, and it's done with care, and it's done with prevailing wage projects. I mean, these are not easy efforts, but the feedback is just overwhelming from the community. And the feedback is overwhelming because it's needed so much.
This facility, which we are going to construct here in Skid Row to meet the needs of thousands of our patients, would not be possible if this funding were not put in place by the state of California, by the governor.
As part of the infrastructure grant from the state of California, we will be building a brand new building in West Covina, California, which will be for inpatient psychiatric care.
The Dolores Huerta Foundation received a B-CHIP grant of over $3 million to construct the Dolores Huerta Peace and Justice Cultural Center. And our focus is specifically on behavioral health.
As you can see, we are really excited to get started. This is a turnkey operation that we were able to acquire just 5 days ago. This is an approximately 27,000 square foot facility composed of 2 distinct buildings. One is a residential facility with 78 beds and a 2-story office building where we'll be providing a sobering center and intensive outpatient drug and alcohol treatment services.
We received just under $16 million. And all of that will be expended here at this community wellness campus.
This is historic. I mean, this has never happened. I've worked in government and nonprofits for over 30 years in my career, and there's never been an opportunity like this to build capacity in this kind of way.
These are things that are going to be truly lasting. And so when the day is done in 20 years from now, there'll actually be these physical structures that build out that access.
We believe in human potential. We believe in a person's ability to be, anything they want to be, but they need support.
We want to reach out to as many, many people as we can and say, look, this is not an isolated issue. This is an issue that affects every single one of us.
I think people are finally seeing that, we are being recognized as a community that need help. And I think the state is saying, hey, we're here to help you. And so hopefully that'll bring hope to the people of this community.
Oh my goodness, this grant is just so exciting. It's going to help do so much here with our community. We'll be able to help them because that's something that's desperately needed.